welcome to Long COVID Foundation podcast. My name is Dr. Valentina Viduto, and I am Long COVID Foundation trustee. This channel is for long COVID sufferers, researchers, practitioners, and a whole host of other people who want to learn more on COVID. Take this second, like our videos, subscribe to our channel, and stay up to date. Thank you. Now, the Foundation aims to find the best rehabilitation solutions for long COVID sufferers. We provide informational resources for people to understand their symptoms better, to educate them, and possibly help them to recover. Today's discussion will be on oxygen. Yes, indeed, it's a very widely studied subject. However, today's focus will be on hyperbaric oxygen chambers and the way how it possibly could help long COVID sufferers. Our invited speaker, Professor Ancha Baranova from George Mason University, will be able to help us analyzing new research studies on how hyperbaric oxygen can be used to treat long COVID symptoms. So stay tuned, take this second and like our video. Thank you. Hello and welcome back to our podcast. Today we have our guest and very great friend, Professor Ancha Baranova from George Mason University. Hello, Ancha. It's great to see you back again.
Hello, Valentina. Glad to see you. Valentine. Today we are recording it on Valentine Day. So my kisses go to Great Britain.
And ours to America. Ancha, we got a very interesting theme today to discuss, and this is a continuation to our previous podcast when we discussed the brain fog. We want to cover oxygen therapies today and potentially discuss how hyperbaric oxygen chambers can be used to treat these long-lasting post-COVID symptoms. Do you know any research that is around that would scientifically evaluate how chambers help these symptoms?
That is a great question, Valentina. I'm very glad to hear this question. Actually, we know about the action of the hyperbaric oxygen for a very long time, because obviously even before molecular medicine, the aim to increase oxygen concentration in a particular chamber was there, and it was tested on patients mostly for improving general health. Then there were a couple of scientific papers about it. They are popping up time to time. And incidentally, during COVID, there was a paper published, a real good paper, coming from Israel, where they, not in COVID, but in the older people, we were giving them hyperbaric oxygen for a long time. So they were actually coming to the chamber, I think 5 days a week or maybe 6 days a week, and had only 1 day break, something like this. And they were going through the measurements of their biochemistry and markers of the inflammation and aging before and after therapy. And by that, I mean before the beginning of the therapy altogether and the finishing of their course of hyperbaric oxygen. They were in chamber between hour and 2 hours. So it was also quite intensive therapy, given that it was 6 days a week. Mm-hmm. But after finishing the course, which was 2 months or so, many of their biomarkers of aging really yielded and came back into the normal territory. So by technical characteristics, their biological age was not as advanced as it was before they started therapy. Of course, this is about old people without any COVID, but does it have really relevance to coronavirus infection? Yes, because right now we are seeing post-COVID. And even in the people who do not have post-COVID syndrome, but they just went through the coronavirus diseases, we can see it as accelerated aging. On the average, moderate course of COVID ages you 10 years. 10 years, that's a very long time. How exactly that works? Basically, you can measure it objectively by seeing the biomarkers of aging, and you can see how they measure up against other people of different ages. Yes, so it's true measurement of biological age. But also you can see by incidence of various kinds of chronic diseases. And COVID doesn't invent anything new. For example, if you had predisposition to diabetes, already developed some propensity to acquiring this insulin resistance. But normally, without COVID, this condition would hit you when you are 60. With COVID, it could happen at 50 already. So those diseases come earlier. But good news, it is reversible. So it's not like you aged at 10 years and then nothing could be done. Okay, 10 years taken out of your life. Not like this. Because those 10 years are shown by biomarkers only after you just finished the disease. And then you gain back, of course, depending on whether or not you have a long COVID tail. If you don't have anything, you are gaining back faster. If you are having various consequences of COVID, then you're gaining back actually commensurate with how fast you are getting rid of the COVID tail. But you are really gaining back. And some people will gain back completely. They would be back in their former selves. Of course, with younger people, it happens more often with older people. Some people will gain back 5 years, some gain back 7 years. We can measure it technically in this way. Now, how hyperbaric oxygen comes into this equation? It helps you to gain back faster, gain back more efficiently. So when you are exposed to hyperbaric oxygen, you are less exposed to the processes of accelerated aging which are happening in the body under the influence of hypoxic condition. The virus is causing hypoxic condition when there's not enough oxygen in the tissues. It's doing it by creating microthrombi, by blocking the access of the blood to the tissues. And if you simply artificially from outside increase the concentration of oxygen, it will alleviate the condition. So basically, it's not forever. It's not like you would have to go into hyperbaric chamber and stay there for duration of your life. Not like Michael Jackson, who slept, according to rumors, in the hyperbaric chamber like every night in his life, because it's quite uncomfortable sleeping. But in this vulnerable moment of your life, when you really need to gain back your ages, you really need all the little support you can get. And hyperbaric oxygen surely is an important support. I should say there are some caveats to this. One important caveat that it was actually shown specifically in certain types of lung fibrosis, that in the advanced lung fibrosis, exposure to the high concentration of oxygen in the hyperbaric chamber actually could produce some problems, like acceleration of the fibrosis. And that is, of course, a warning sign. And in every particular case, the doctor needs to evaluate your particular situation and give this recommendation depending on your lung fibrosis. But luckily, in coronavirus, only few people stay with like 80% damage or something like this. Majority of the people are gaining back. And in those situations, the oxygen is helping you to gain back faster rather than to consolidate fibrosis and make the production of the collagen in the lungs more pronounced. That is because in the people who are vulnerable to high concentration of oxygen, and they actually do produce fibrosis in response to it, there are almost no epithelial cells in the lungs. The only cells which are remaining there are fibroblasts, which are producing this collagen and making everything so tight in the lungs so you couldn't breathe anymore. So if your degree of the damage to the lungs is gaining back, say you were at 50% and now you're at 30%, that means you are recovering, you're not consolidating, and the oxygen is safe for you. But if you are at like 70% and stuck there, then doctor need to evaluate it, whether there could be potential harm. Now, there are other things which are coming from the oxygen. One is that, unfortunately, there is just general problem with oxygen use in various countries. For example, here in the United States, we have very tough fire codes, and oxygen, when it goes to hyperbaric chamber, it needs to be very tightly controlled. Somebody cannot really install it in your house and use time to time, because it's a requirement that somebody need to sit conscious around it and look whether any leak is happening or something like this, which is limiting the use. So you can only use it in specialized center, or you can hire somebody who will be watching you when you sleep. And of course, that is very, very expensive way, right? So I'm not sure how exactly fire codes are organized in the United Kingdom, but I somehow think that maybe using the centers with hyperbaric chambers is more possible than actually using it at home. But there are ways around, because COPD, which is chronic obstructive lung disease, is a very well-known condition. And a lot of old people with this condition need supplemental oxygen. And of course, the supplemental oxygen is not that concentrated. It didn't come under such pressure like in hyperbaric channel, but it is really important. And yes, if you cannot get all the benefit, at least it's very reasonable to get part of the benefit. So you can get the same machine like all people with COPD using, which is using concentrated oxygen, or you even can use so-called oxygen concentrator. Concentrator is very safe. What does it do is like a little centrifuge inside the machine, and this machine just enriching the oxygen from the air, and then you are using oxygen as it comes. So it will go straight to your nose. And of course, through the little tubing, it will not go to that high concentration like in the real hyperbaric oxygen chamber, but you can use it 24 hours a day if you need to.
In this case, you've mentioned these concentrators. So we know the benefits that it can help with the brain function, it can help with the anti-inflammatory properties, it can help with tissue regeneration. But then when we come to making a choice whether to go for a concentrator and use at home, or maybe possibly find a chamber to use, how much is enough of extra oxygen to help with these symptoms? How we can know whichever option is better for us?
It's a good question. Unfortunately, there are no quantitative science about it. So we really do not know, because those experiments done in Israel, they were with hyperbaric chambers, not with breathing oxygen, but it's the same compound, and I don't see the difference, frankly. I think that surely we need more studies, but I think that we can use the rule as, use it as you can, because the major limiting condition here would be how much money you would be able to pour into this therapy. Certainly, concentrator, you just buy it once, and then it will be making oxygen for you, not as high concentrated as in hyperbaric chamber, but it will be making it for you on demand whenever you need it. And you can have very prolonged therapy with it. It's your equipment, you are using it. And this is not a flammable thing. So it's just an enrichment and usage exactly when you are making it. You're basically taking oxygen molecules from one corner of the room, and you are specifically bringing them to your breathing space, and that's it. When you are going to the center, because of the fire codes, because of the requirements, because of the high pressure equipment which is needed, it just cannot be made that cheap. So I would say maybe the good idea here is to find out whether you are under any risks of hyperbaric oxygen. So go to the doctor, get assessment first. If doctor would write to you, yes, hyperbaric oxygen is good for you, which I think would be 90% of cases, then you can get into this hyperbaric chamber, see how it feels, because it's not for everybody, I can tell you, because people get claustrophobic in these chambers. If you are a person with certain level of anxiety, it might be a trigger of anxiety. And I know people who knew it would be very good for them to go in this chamber, and they willingly went in, and then they had panic attack inside, and they had to leave. And nothing could be done about it. And I do not advise like taking anti-anxiety pill and then go to chamber, because frankly, you are damaging yourself and then you are getting some good. It didn't make sense. So if you cannot do it, then you cannot do it. And then you just know that oxygen is all right for you, and you are using it as a general prescription for having your oxygen through concentrator and using your concentrator. One thing which I should say is that you shouldn't expect a quick benefit like this. Neither from chamber, neither from oxygen concentrator. It's working with time. So it will be working, just give it time. You really need to be persistent and at this, and you will see the effect. One more thing which I want to say, at least in the United States, there are right now a lot of so-called recreational, don't ask me why it's called recreational, really oxygen is not a drug, yes? I mean, it's not a mind-altering drug, even if it can alter mind, yes, but it's oxygen. But there are sales of so-called recreational oxygen. So those are basically like VIF cans, and you can just press the button, and you can breathe this oxygen. And even in the beginning of the coronavirus epidemics, there was an advice, okay, let's buy this oxygen, let's store it, like in case if we will need it, we will use it. Of course, it's good to have as an emergency supply, but it cannot be seen as any serious intervention, because every can of oxygen good maybe for 10 breaths, maybe 15, I don't know if it's a large can. So it's just fun, nothing more. And it's a flammable fun. So please keep it in mind. It's really not a solution in this particular case, even if it is an expensive thing, but there is a reason why it's written there, recreational.
COVID is spreading around the world, and every scientist is looking for best viable option how to help long COVID sufferers. So from your point of view, can oxygen therapy be used as a potential to help ease these symptoms in long COVID sufferers?
Yes, absolutely. Absolutely. But if you just put everything as a perspective, you will see that existing hyperbaric oxygen chambers would not be enough. It's a question how quickly they would become into fashion, and as soon as they become into fashion, even with current price, which is very steep, they would be overflooded with people who need therapies. So I do not expect that doctors would be actually proactively prescribing them. But you may ask, because this is one of the ways of rehabilitation. If you don't have any counterindications, then you can use it. On the other hand, for concentrator, if you're able to purchase concentrator, it will stay with you. It will be not as efficient as hyperbaric chamber, but then you would be able to use it in many other conditions which are associated with not enough support by the oxygen, like for example, so-called cluster headaches, which are quite little bit different from migraines. It's very, very strong headaches, which are like very sudden, and cluster headaches happen in men more often than in women. In women, more often it's a migraine. It was shown in scientific papers that it does help against cluster headaches. You can use concentrator for this. It's not immediate, but you will have a relief without any drugs, which I think it's a great benefit. And altogether, in the old age, if you see that you are tiring faster, you have brain fog, it might be because the oxygen is not really coming into the tissues in the right quantities. We are not breathing as intensively. Our exchange of the gas is not as intense, and it was even without any COVID. So it could be beneficial in those situations as well, providing that you exclude this possibility that you have consolidating fibrosis in the lungs, and in such case you need to have this therapy. Even, there was a therapy with oxygen when people, it's actually also a scientific paper published on it, when people with metastasis in the lungs were treated by the hyperbaric oxygen, and even in this very severe situation, when people had cancer and they already cannot be treated with any other therapy because chemotherapy was already not efficient in those cases, they were able to keep their metastasis, specifically in the lung, stable for quite some time with an oxygen. Of course, it wouldn't help with other places in the body, so it's not a definite cure for cancer, don't get me wrong. But in the atmosphere of the larger amount of oxygen, at least lung problem would be getting away to some degree.
Yeah, because, for example, what we see very common people when they leave hospitals, when they've been in ICU, they stay with 50-60% damage of their lungs, and they hope for any solution that would help to restate this capacity of lungs. But then oxygen mask, is it something that they can consider as a 15 minutes therapy and dream that it will recover them at some point?
Well, it's so everything needs to be put in proportion. Yeah, why I am a proponent of the home treatment more, because if you are coming to the treatment with oxygen mask and oxygen is given for you for 15 minutes and you need 1 hour getting there, 15 minutes of treatment and then 1 hour getting home, maybe you get more exhausted in comparison to the benefit which you will get. So it's also need to be all put in the perspective. We would have all drive somewhere and also maybe contact virus on the way, interact with people, plus there will be costs associated with this. So I would say there is middle ground for sure is not cost efficient. Hyperbaric chamber on one end, middle ground with this mask thing, just too much bother, and concentrator on another thing. So you actually having choice between those two, because in the middle you both pain and not getting enough benefits. So why do so? Please do not discount very important ways how to enrich your blood with oxygen. If you walk, even slowly, but you will be walking outside, especially if it's a countryside, not in the middle of London fog, of course, right? You really need to breathe. Opening the window, if you are immobile, might happen that you cannot walk, right? But if you open the window and sit near the window, it is better than sitting in the room which is already packed with CO2 which you breathed out. So those simple ways do work for sure.
And again, I would like to share some great news. As a foundation, we started to support opera breathing exercises that one of the experienced opera singers provide to long COVID foundation group members, is to help us use our lung capacity, not just the top part, but also the bottom part. She's demonstrating techniques how to best get the oxygen in and out. So could you please, from biological scientific point of view, tell if this is a good thing for people to do?
Opera exercise is definitely good because they actually like slow stretch exercises. It's not like you trying to blow a balloon, right? Because in this case you might over exercise certain part of the lungs, but because opera exercises are commensurate with normal breathing at just larger extent, and you learn how to control your breathing, and you really improve the exchange of the oxygen on the surface of the lung, that is really good idea, and it's also help you oxygenate the blood for sure.
Thank you, Ancha, for covering this theme. I think for people it's going to be much clearer now whether oxygen therapies would help in long COVID symptoms, and you've covered quite a lot of benefits of them. So let's hope it's going to be our option number one in long COVID recovery. Thank you and bye.
Absolutely. Bye. Bye-bye.
Let me remind you that all our videos are for educational purposes only. For medical advice, please speak to your general practitioner. Thank you for watching and see you next time. Bye.